Alright, so this is going to be a video for the lung and thorax. So first thing, we're just going to start by inspecting the patient, checking their lung, making sure that there's no, or not their lung, but their chest, making sure that there's no pectus excavatum or pectus cranivatum. We're going to be looking at tracheal deviation, so I'm going to place both of my two fingers right on your trachea, and then the third one's going to be right on top of that, so sternum, clavicle, and then trachea. Making sure that that is in line. Tracheal deviations can mean a lot of different things, thrombosis or different other associations. So then we're going to move down to the hands. We're just going to, I would have the patient raise both of their shirts, or their shirt up to their arms, but in this case, we're just going to go through it. So inspect the hands for clubbing, cyanosis. We're going to do a finger tap test, so we'll flip over. And any pain with any of that?
No.
Okay, so the other side, no pain with any of that?
No.
Okay, there's no clubbing, no cyanosis, anything along those lines. Next thing we're going to do, we're just going to have the patient flip over and we're going to check her radial pulse. So we're going to use our two fingers and I'm going to go for 15 seconds. Okay, patient's at 72, that's normal pulse. Respirations were at like 18, I think, what are we at, like 18 I think is what you had respiration, so that's a little higher but normal. And then, so now we're going to move on. Hold on. And we're just going to do lateral chest expansion. So I'm going to ask the patient to raise their arms. And we're just going to find the 7th intercostal space. So it should be about right there. And then lower your arms and just take a deep breath in. Okay, good. And then ask you to take a deep breath in again. Okay, that'll work. Alright, so next we're going to have our hand on the base of the patient. We're just going to have him say 99. So say 99.
99, 99, 99, 99, 99.
Okay, good. That works. And then we are going to go through and do percussion. So we're going to go through all of your ribs, intercostal spaces. Let me know if you have any pain with any of this. I'm basically just going to run through and percuss these. Any pain?
Nope.
Okay, that's normal. Okay, there we go. And then we're going to come behind the patient and we're going to just do some hearing. We're going to go make sure that we're on the skin, so we're just going to go below the shirt and make sure we're on the skin. And I'm going to ask the patient to just say Scooby-Doo when I move the stethoscope around. So I'm just going to come below here. Can you move your head out of the way, please?
Mm-hmm.
Thank you. Okay, and then just say Scooby-Doo.
Scooby-Doo.
One more time.
Scooby-Doo. Scooby-Doo. Scooby-Doo.
Okay, there we go.
Scooby-Doo. 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 Scooby-Doo.
I'm going to finish with that last one.
Scooby-Doo.
Okay. And then after that, we're going to have the patient whisper periloquy. And we're just going to go through again, listening for making sure that there is vibrations in there, in the noises, and making sure that is normal. So whisper it, it's just very quietly. Okay. And that's the end of it.
Awesome.
I'm trying to make sure I'm not missing anything.